Okay, in this third lecture in pseudomembranous colitis station in pathology, we are going to answer the question, what are the other symptoms for pseudomembranous colitis? And he's saying here other symptoms because he mentioned some symptoms in the scenario. As you remember, he told you that this guy or this lady or whoever he is has abdominal pain, has fever, and has diarrhea. Okay, so you want to be smart. You want to get some symptoms from the scenario. If you do not, maybe you are in tension and you forgot all the symptoms. Look at, you remember the scenario. Scenario is always on your hand inside the exam. So you can look at it. It told you abdominal pain, diarrhea. So you can tell that it could be bloody diarrhea. Okay, or 2, watery diarrhea, which may lead to dehydration, for example. Okay, this is a point. There is already abdominal pain in the scenario, right? But there may be abdominal distension, right? Why? Because one of the complications of pseudomembranous colitis is toxic megacolon, and in that one, abdominal distension will develop. Okay. Fever is mentioned there also. You can mention all the symptoms of the GI tract when it gets sick. You can mention nausea. You can mention vomiting. Okay. Fever already mentioned there. Fine. So that's it. To conclude this, you want to look at the symptoms that are mentioned in this scenario of the station. There is diarrhea there, so it could be bloody, it could be watery, they will lead to dehydration. Okay. You want to remember the GI symptoms in general. Abdominal pain is there, it is mentioned already. Abdominal distension, not mentioned, mention it. Nausea, vomiting, all these are. This is an infection, and infection will lead to fever. It is already mentioned there, but if it is not mentioned, you can add it, or you can mention it and tell that it is already mentioned in the scenario. So this is the answer for this question. It's so easy, and you can get the full mark in this.